Good morning, everyone. Welcome to day 2 of the Texas State of Enrollment Conference. We are so happy you're back for day 2. As we have started all of our sessions this week, we will be starting with setting up our language channels. And so I will be passing it to my colleague, Azucena, to get us started.
Thank you very much, Katie. Can we get the channels on, please? Good morning and welcome. We are going to be offering English, Spanish, and Vietnamese interpretation for this conference. And are we going to share the slides?
Yeah, sorry.
Okay, it's okay. And so for those of you that need the service, let me guide you through the process. If you're joining us from a computer, please look at the bottom of your Zoom screen and you're going to find a globe that says interpretation. If you click on it, you will be able to make your language selection. If you're joining us, next slide, please. If you're joining us from a mobile device like a tablet or a cell phone, please look for the 3 dots that say More. And there you will see the option to select language interpretation. When you click on it, you will be able to make your language selection. And just make sure you click done after you have made your selection if you're on a phone or a tablet. We encourage everyone, strongly encourage everyone that is not fluent in one of the languages that to please, or in English, to please make a channel selection. And I'm going to ask my colleague Vic briefly to go to the English channel. And those of you that are there, please, you should be able to hear him. And if you don't, let us know in the chat. Thank you. And now I'm going to give instructions in Spanish. Next slide, please. Buenos días y bienvenidos. Vamos a estar ofreciendo interpretación simultánea al vietnamita, español, inglés, por supuesto. Y para las personas que necesitan este servicio, si están acompañándonos desde su computadora, por favor vean en la parte de abajo de su pantalla de Zoom, van a encontrar un globo terráqueo, un icono que dice interpretación. Si hacen clic ahí, van a poder elegir su idioma de preferencia. Next slide, please. Si nos están acompañando desde una tableta o desde un celular, lo que hay que hacer es ir a buscar los 3 puntitos que dicen más o more. Ahí se les va a desplegar un menú donde está la opción de interpretación de idiomas. Si hacen clic en interpretación de idiomas, van a poder elegir su idioma de preferencia. Y desde un celular o una tableta hay que hacer done, hay que hacer clic en done o listo después de haber elegido el idioma. Le voy a pedir ahora a mi colega Vic que por favor vaya al canal de español y las personas que están ahí deben escucharlo. Si no lo escuchan, por favor nos dicen en el chat.
Kính thưa quý vị hiểu rằng là cái hội nghị này á, có hỗ trợ về phần phiên dịch. Nếu quý vị đang dùng cái máy vi tính của mình á, thì quý vị làm cho 3 bước. Bước 1, phía bên góc tay phải ở trên á, quý vị bấm vào quả địa cầu. Bước thứ 2 á, là bên góc trái, quý vị chọn dùng cho ngôn ngữ, ở đây là tiếng Vietnamese. Và bước thứ 3 là bên góc tay phải, phía dưới, quý vị bấm vào Vietnamese, thế là xong. Nếu quý vị mà dùng ở điện thoại di động cũng là 3 bước. Bước 1, quý vị bấm dùng vào chữ More ở phía trên, có góc 3 chấm. Bước 2 thì quý vị bấm vào ngôn ngữ phiên dịch, ở đây là tiếng Việt. Và bước 3, quý vị bấm vào chữ Done, thế là xong. Cảm ơn quý vị.
Thank you.
Amazing. And if we could get our interpreters labeled as interpreters, that would be greatly appreciated. Thank you, Jeff. And again, thank you to our interpreters. Thank you to our speakers and all of you all for joining us for day 2. I can't believe we covered so much content on day one. Day two, we have this first session and then our last session at 10:30 a.m. Central Time. As a reminder, all slides, recordings, resources shared during our presentations will be shared post-conference. So do not fear, we will make sure you get those. And if you are currently in the lobby, we of course invite you to join us in the webinar space. In the webinar space, you are able to use the question and answer function as well as complete the poll at the end of the session. And with that, I will be passing it over to Lynn to kick us off. Thanks again.
Thank you, Katie. Oh, there we go. Also, big thank you to Katie and Simona for organizing this conference, making all the different components that come with running a conference possible. And I can't say enough thank yous to y'all too for making this happen. Today's session is a little bit different than the ones we've had yesterday, and honestly than some of the ones that we've had in the past at the Texas State of Enrollment Conference. We did like lightning reviews yesterday of some pretty significant, very significant policy changes and application changes and program changes that we'll see across the state of Texas in 2026 and 2027. And, Stacy Pogue from the Georgetown Center for Health Insurance Reforms talks a little bit about 2028 as well. And so what we're going to do today is kind of like take a lot of that material from yesterday and focus it on like everyday situations. So the kind of like hows and whys people come into our offices with different types of questions for enrollment. So, which is just to say, I hope everybody has had a little bit of coffee this morning or a little bit of bubbly water or whatever wakes you up in the day. A good hug or a good scratch from a dog or whoever's around. So what I'd love, which is just to say, I'd love to have as much engagement and as much participation today as possible. Every year at the end of the Texas State of Enrollment Conference, we get such awesome feedback from attendees. And one of the things that people always say is, I'd love if we could review some more scenarios, right? I'd love if we could take all of that information and apply it to everyday things. And so that's what this panel is going to do today. And Sonia, I can see that you have your hand raised. Is there something that you want to talk about in advance? And again, like, because this is going to be like hopefully a super interactive session, please do raise your hands. Also, thanks, Sonia. If there's anything that you want to like say out loud, we have on our end the ability to ask people to unmute. So again, I would love for this to be as much a conversation as possible. So pop Q&A in the Q&A function here in Zoom, or use the chat, and we will go ahead and get started. So we're on our fifth section here for the Texas State of Enrollment Conference, and this one's on consumer education and also assister resources for working with as many people as we can work with in the next, in the coming months, because there's just going to be a lot of demand. There's going to be a lot of, as we talked about yesterday, a lot of people with concerns, maybe confusions, definitely like things they want to talk about connected to healthcare for 2026. I am so honored and happy and overjoyed, honestly, to be in this space with our interpreters, with Katie and Simona, with conference organizers, Sonia from the Texas Association of Community Health Centers, Sara from Young Invincibles, and also these two amazing people, Monica and Connie from MHP Salud and from the South Plains Community Action Association, who are we've known each other for years, but the work that y'all do is so incredible with your teams, with your communities, making sure that folks know what's available for them. I feel like I am the least expert in this room and just like so excited to share space with y'all. So thanks so much for being here. This wouldn't be possible without you. The work wouldn't be possible. The conference wouldn't be possible. Thank you so much. Okay, so we've got a few goals for this panel. Like I mentioned, it's a bit different. We're not going to have just a bunch of people going through very specific overviews of what's happening in the state and how it's going to affect people's healthcare. What we're going to do is talk about everyday situations where we take all that info and we apply it, right? So one of the things that is really helpful about I'm hopeful this panel is that I want to learn as much as possible from the people who are here, right? We got over 100 folks on the call right now who have so much experience working with community members, working with community partners and faith organizations, clinics, hospitals in your areas. I really would love to learn as much as possible about what's happening there and how we can best create tools and guidance and just really like set the stage for all of the amazing assisters on this call to have everything that they need to feel supported and to feel ready for an upcoming open enrollment period and the coming year also, right? I mean, as far as like Medicaid applications and SNAP applications and so forth that are going to be difficult because there's so many changes happening right now from the federal government, from state programs and so forth. So learning is a big goal for today's panel, for our first panel for today. Again, so I would love as much as I would love to learn as much from y'all as possible. So use that chat function, use that Q&A function. Let us know if we can unmute you so that we can have a conversation, and whatnot. And then I'll share a dense a dense set of tools and resources that assisters can use around the state to help people enroll in different healthcare and food security programs. Some of them are listed here on this screen, others are not. I'm gonna go through that folder a couple of times, and we won't even touch everything that's in it today. And so one thing that folks on the call can do is get into that folder, see if it's helpful as you train your teams, looking forward to open enrollment. Give me a call, send me a text message, send me an email if you want to talk about like specific things in that folder. But so we'll review that today. And then the last thing that I want to make sure that we do in this first session is just like connect, really. So make sure that everybody on the call knows there's many different ways that we can engage throughout. Well, actually, I'll just switch my slide here. There's many different ways that we can engage throughout the year. One of the best ways that we can help, like the offices that run these healthcare programs, like in Texas, the Health and Human Services Commission, in the federal government, the Centers for Medicare and Medicaid Services, like the only ways that people who run these programs know what we need to make them better, what we need to make more people healthier, they have to hear from us, right? And so one of the things that I do is like I talk to y'all, and I'm so grateful for all the feedback that I get from folks on this call. But I talk with y'all, and then I share that info with them, right? In meetings, in like formal letters and suggestions for improvement and whatnot. So that's how we make the whole system better, while we have what we have here. And so this is really like this call, and not this call, but like the people who are on this call, y'all, assisters across the state, community health workers, promotoras, case managers, social workers, patient advocates across the state, like y'all are the experts. You have the information that all of our, program administrators need to make these programs work better for people. And that's one thing that we want to do, that we want to really like foster at the Texas State of Enrollment Conference. So that we can, make our healthcare system better for folks, which is a weird thing to say right now because there's so much happening that feels like, nah, it doesn't feel like it. It just is, right? Like our healthcare system is getting worse for many people right now. And I think we just have to be honest about that, and do what we can to make it work for as many people as we can and say moving forward. And we've got some resources for this also, but like moving forward, what can we do together to make sure that the people who use these programs have a voice in how they work, in who they cover, and moving forward, like how we can prevent the backsliding that we're seeing right now from happening. Which is to say, healthcare is a really, really important like entry point for a lot of people to get engaged with how our state budgets and our federal budgets affect our healthcare. And they do, right? If there's not money in tax credits, for instance, Blake yesterday talked about this. Stacy yesterday talked about this. I talked about it a little bit. If our government budgets don't reflect the need that people have to have affordable healthcare, then things happen like, could possibly happen by the end of the year. Like we could lose the enhanced tax credits that make this system so affordable for folks. So I'll share also just very briefly some resources for what we have been calling constituent advocacy or patient advocacy moving forward, so that people who, again, are using these programs know the power that they have to help make their healthcare system keep working for them, and if it's not working for them, how to make it better. Okay. So let's move on. Actually, let me just go through some of this real quick. So one of the things that we do, and I fully like blew through this slide yesterday. Everything was happening so fast. So I'm just going to slow down and I'm going to read some of these things a little bit more thoroughly. So we have our Get Covered Texas Coalition meeting, which happens on the fourth Wednesday of every month at 2 p.m. This is a call with about, 30, sometimes 20, sometimes 50 people from across the state who do enrollment work, just like everybody on this call. We talk about what's working. We talk about what's not working. We've been doing a lot of updates recently since there's been so much happening at federal and state levels connected to even stuff like changes to birthright citizenship, like if people are not citizens as soon as they're born in a US hospital, like how does that change their healthcare options, right? So we cover a lot of different topics, of course, like, marketplace applications, applications on yourtexasbenefits.com, right? All those things. So that's a really awesome call. We've got running notes and stuff for it if anybody wants to read through those. But yeah, let me know. My phone number's there, my email's there. Let me know if you want to get in on that at any point throughout the year. You don't have to join every month. It's just like it's a helpful space that's there for folks when you've got something to bring to the table, or when you just want to learn what other folks are doing around the state. We also do ongoing training at Every Texan. So, I think next week, I'm doing a presentation to Harris County Public Health on immigrants' access to healthcare. I'm building a couple of tools for one of our sister groups in Longview. They've just got like some specific populations of people who they want to make sure get covered. So helping them do some community outreach. So we do ongoing training with individuals and with teams throughout the year. And Martha, I see your hand raised. Is that something? I can't see the chat. I don't know if you put anything in the chat, but let me see if I can unmute you. And Mary, I can see you have your hand raised also.
Hands went down, Lynn.
Okay, thanks, y'all. Cool. And right, so ongoing trainings throughout the year. Email me, call me if I can, if I can help, or if we can get somebody else in the room who can, be an expert for whatever topic is helpful to y'all. We also have office hours every other Thursday at 1 p.m. for an hour. I got yesterday after day one. You just have to click on that link to register for office hours, but like a lot of people registered yesterday, I think, because I shared that link in this space, which was awesome. So I'm looking forward to some office hours with a lot of different folks. And for office hours, like, I mean, we can talk about anything. Like some people will bring like individual cases. Some people will bring like ideas that they want to talk about, as far as like, how can I do, and this is one conversation I had with somebody in office hours recently, is like doing pre-enrollment appointments so that when people come into your offices during open enrollment, they're prepared, right? They have their login information for healthcare.gov. They know about their employer coverage options. They know that they have to, now especially bring their immigration documents if they're eligible for coverage. So just like getting all that pre-enrollment stuff kind of like out of the way so that as soon as that family comes in during open enrollment, you can get through that application as quickly as possible. So yeah, we talk about all kinds of stuff in office hours. It can be individual cases, it can be general stuff. You can sign up at that link here. And also, you know, I do a lot of technical assistance, and sometimes with clients on the phone, if we have to call the Health and Human Services Commission and figure out like what's happening with an application, I can't do that by myself without permission. And so sometimes we'll just get on a three-way call and we'll call HHSC together and, you know, get to the bottom of what the delay is or what they need from somebody to get them enrolled. We also have, you can see the fourth item down here is the Texas Outreach and Enrollment Digest. This is a newsletter. Thank you so much to our communications team at Every Texan for getting that out. It has a bunch of stuff in it. We're actually switching platforms right now too. So if you've been on if you've gotten the Texas Outreach and Enrollment Digest in the past, it's been in like a different format from a different mail server. So sign up newly at that link there in the slide, and make sure that when we haven't sent one out yet in the new format, but when we do, that you save that email address in your contacts so that the email doesn't go to your junk folder or anything. But yeah, I mean they've been pretty stacked recently with, you know, program updates, invitations to things like the Texas State Enrollment Conference. If anybody's in Austin, invitations to our policy summit that we're hosting at the end of October. I bet we can share a link in the chat for that. Also, if anybody is in the area, that'll be in person. There's no cost or anything to join. But yeah, events, updates, you know, ideas, tools and stuff, all of those things go out in the Texas Outreach and Enrollment Digest, or the TOAD. So you can sign up for that here too. And then the last two links here, one of them I send out about every quarter, or that's my goal. My goal is to send that out every quarter. I think I probably do it like twice a year right now, honestly. But we'll call it quarterly because that's my ambition. It's our sister feedback survey, but you can also fill that out anytime. Let me actually just click on that and just to show everybody what it looks like. Oh, that's not right. I might have to. Okay, yeah, there we go. So this should open. Oh, don't look at my tabs. Don't do that. Right, so this survey, it just says, like at the top of it, you know, what is this for? It's basically just to share your experiences with enrolling clients, and questions that they have. And if you have tricky cases, or, I mean, and there's a section here also for like things that are working well, you know, if, I mean, and one thing that has been working well, generally across the state has been, the Health and Human Services Commission has been able to review applications for pregnancy Medicaid within 15 days, pretty consistently. Like that's awesome. There's, you know, that's a very medically heavy time in people's lives when you're having a baby. And so the fact that the Health and Human Services Commission is able to prioritize those applications is fantastic. We want them to keep doing that. So yeah, there's a section here on like what's going well, right? That's this one here. This section here is just like what types of applications are you working on? That's helpful for us to know also. Are you doing marketplace applications and your Texas benefits and Social Security and, you know, other types of applications? So what's running smoothly? And then if there are any specific cases that you want to write about, there's a long kind of like form here. You can write as much as you want or as little as you want in these sections. And then a really important question is like, what barriers are you seeing when you're helping people enroll in programs? And so there's definitely like a lot of options here from different things that have happened to folks across, you know, around the years, or over the years, but then also a section at the bottom for other. So like just for instance here, clients are losing SNAP benefits because of fraud or because of skimming. So when somebody takes their card's number and uses that without their permission, right? So that has happened some. HHS staff are not able to answer questions when people are calling into their offices, right? That's a problem. This has happened a few times recently. People just didn't get their SNAP dollars added onto their Lone Star cards when they were supposed to. So that's an issue. And, you know, you can multiple choice any of these things. We don't have time to go through this whole form today, but if you want to use this for your team, if you want access to the data, if you want to build one of these, if you want, you know, I can help build one of these if you want to track some of this information just for your team, you know. But this one here is for people across the state. So just know that that is there. And then the last thing that I'll click on here is the thing that we will focus on the most today, which is our sister resources folder. This folder, I would love to know. There we go. If there's a better way to organize it. I know that, like, you know, this is gonna, like, I'm not gonna just like click through this folder for the next hour, because that would be terrible for everybody who's joining. Even if there is the option for a gift card at the end. We'll get some scenarios going, we'll get some engagement going. But yeah, I just like, I want to make sure that everybody knows that this folder is here. Again, we like with that form, we don't have time to go through the whole thing today, but we are going to start with some scenarios to figure out, like, or to go through like how to use this folder, right? So I'm just going to take 5 minutes. I'm gonna go through some of the sections here. And then we'll move into some scenarios with Connie and with Monica. And so the first thing is start here, right? Sister resources links are in this document. If you open it up, you can see that there are some like training things that we've put together with Every Texan. If you click on this link here, it'll take you to our website, and you can see all of our enrollment videos from past conferences like this. I think 2 of the most important ones in that section are our Your Texas Benefits application walkthrough that Amy Cuellar from Feeding Texas did 2 years ago, and then our Marketplace application walkthrough that the fabulous Ariana Anaya, who visited with us yesterday, did last year. The applications do change a little bit, right, over time. The Marketplace application usually more so than the Your Texas Benefits application, but the information is still relevant, still timely. They just, you know, the CMS just like removed the page about gender identity and sexual orientation, right? So that page is no longer there. And now there's the new flag at the top of the Marketplace website at healthcare.gov when you log in that says like DACA recipients are no longer eligible, right? So those things are new. You won't see those in these videos, but most of the information is still good. And you know, we'll update those over the years too, but we didn't have time for that this year just because there's so much going on. Also some information about like Medicaid and CHIP resources, right? The ACA Marketplace. I did not have time before the conference today to fill out this second tab here. But basically what that's going to be is just like, it's just going to be like a site tree for all of these different folders in this document here, or sorry, in this folder here. So like, it's basically so that you can hit Control F. And if you're looking for something connected to refugees, right? I can have the link there for all things refugees. Or if you're looking for something because you have a diabetic client and you want to look at diabetes resources, you can just hit Control F and look for the word diabetes. Because right now, you can search this folder. So if you come up to the top here, and everybody can still see my screen, right? Yeah, okay. If you come up to the top here and you search in Drive, so you can search for anything in this folder, right? So if I search for FPL chart, you can see all the different FPL charts that are in this folder. If I search for income, right, you can see, well, the low income special enrollment period is closed. So that is in our archive folder now, but maybe I should just take that archive folder out. But you can see templates for income estimates. You can see income and tax guidelines, the form that Claire shared yesterday, right? So you can just pop words into the top of this search bar also and find what you need. But sometimes it's easier for folks to like see the site tree. So that's what will be in this tab here. Just didn't have time to do that before today, so sorry about that. So going back to the folder, I do want to make sure that we cover one thing before we actually get into some scenarios. So we'll look at 3 different versions of a federal poverty level chart, like the ones that Ariana shared yesterday. We'll get to that here in a second. That's going to be in our ACA Marketplace Applications and Enrollment folder here. That's the folder that we'll focus on the most today since open enrollment is coming up. But I just want to make sure that folks know that these other ones are here too. There's a whole folder here on client storytelling. And this is one because like I mentioned, you know, the way that we make this system better is by telling the people who run the marketplace, the people who run Medicaid, like how the system is working or not working for people, right? And so a really powerful way to do that is by getting individual people who are covered by these programs to tell their stories. Media oftentimes want to hear them too. We at Every Texan want to hear them because we use those stories in our reports and in our analyses, right? Of like the different ways that these programs are failing people or helping people get healthcare and food, right? So client storytelling is really important. So there are some resources here. I actually don't have anything in the community outreach folder for right now, but it's there. Because when we have more time and more funds to do community outreach, of course, there'll be a lot of opportunities. But also, I mean, like everybody on this call knows, you know, the people who you live with and what, you know, what inspires them to come into your office. And so community outreach, and this is actually the topic of our next panel today, not community outreach specifically, but like regional connections, how we can work together to make sure that we get more people covered during these really challenging times. And so I bring that up because community outreach oftentimes is very place-based or very regional, you know, like what's happening in your town or in your area that's important to people, you know, and it's like inspiring them to either get health insurance or not, or to, you know, to seek out other resources. So there's nothing in this folder right now, but there will be once we all have all the funding that we need to do all the outreach to get everybody covered. And then, like I mentioned, there are some resources here for constituent advocacy. I linked here to the storytelling opportunities and resources, some talking points for the media, right, about enhanced tax credits, about some of the issues that are the most important as far as keeping people covered in Texas. There's some guidance here to submitting comments to federal agencies like CMS or like the Health and Human Services Commission. That's submitting comments is one way that we tell agencies like what's happening, right? And then when the Navigator funding cuts happen, there's just a couple of guides here to constituent advocacy for those to try to replace or restore some of those funding cuts. Of course, that didn't happen, but constituent advocacy, regardless, super important. And we'll talk about that a little bit in our next panel also. General info and healthcare education is a pretty stacked folder. If you click on this one here, you'll see there are some condition-specific resources that we'll get into, data as far as enrollment data, like statewide enrollment data, some regional enrollment data also, depending on where you live. Like if you're in the Rio Grande Valley and you want to know like how many people in Hidalgo and Starr counties are enrolled in Marketplace Health Insurance, you can go to this data folder and you can click on 2025 open enrollment data and check by county and see. And if you don't want to do that, let me know. I'm happy to break down some of those bigger data sets for you, in case, you know, knowing about uninsurance rates in your area is helpful, because it always is. You know, like if you see the uninsurance rate in one county versus another, that can help sort of like figure out what's going on there, right? Are there not enough clinics? Is there not enough education about health insurance and so forth? And then there is some info here about federally qualified health centers and community clinics. Those are mostly just links to the Texas Association of Community Health Centers. Preston Poole spoke yesterday, and also Paula Walker yesterday did a great presentation about the Texas Association of Charitable Clinics. So you'll find some of those resources there. I broke out the folder on HIV and AIDS resources just because it's such a complicated topic, connecting people to their local AIDS services organizations, making sure they have the medications covered by their health insurance plans. All those are guides to those things are in this folder here. Immigration information and resources, we'll go through that today also. Some info about Medicare, which again, that my presentation yesterday on Medicare was it was basically like, here's some slides on Medicare, move on, right? So those are all there too. Resources for uninsured people, of course, some info about junk health insurance, also called short-term limited benefits coverage, and then some different presentations that we've done over the years, just training-wise. So those are all there. Also, talking points for businesses. It can sometimes maybe that should go in the community outreach section, but it's here for now. Also, if you're ever talking to a local business and they're like, why would I connect my employees to a local certified application counselor or navigator, right? There's just some like helpful guidance there for talking with businesses, and then the effects of different types of employment on health insurance you can see in this document here. So like if somebody has a health reimbursement arrangement from their job, or if their job offers like an individual coverage health reimbursement arrangement, or if somebody has two part-time jobs and one of them might offer them a health insurance plan, or if somebody has a full-time job that doesn't offer them health insurance, right? Just like how all those different types of employment statuses affect health insurance. Okay, let me go back. And I'm almost done here. There's a lot of different folders, but again, click through this when you get a chance, or if you don't get a chance because everything's busy right now before open enrollment, schedule some time with me during office hours. And if there's like a specific topic you want to talk about or anything, we can do that. Katie, I see your hand.
Yes, quick question from Jen. For your office hours, is it only for your Texas benefits, or can you also assist with ACA issues as well?
Yeah, that's for all things. So yeah, we can talk about your Texas benefits. We can talk about ACA. We can talk about national health plans that don't exist yet. We can talk about health insurance for people who are traveling internationally. We can talk about anything you want to. Yeah. Thanks, Jen. Okay, there's some stuff here about the Texas Department of Insurance, verifying application data. That's a really stacked folder also. I'll click on this one real quick just so folks know that this is here. This is the Your Texas Benefits, or the HHSC Assister Resources folder. I think the most important thing here, there's some guidance for SNAP there, some different, let me see here. I think it's in this folder, HHS forms. Yeah, sample client letters. These are so helpful for training. Unfortunately, HHS letters don't change as often as we would like them to. We would love for the letters that people get from the Health and Human Services Commission to get clearer and more easily understandable, but they've looked the same way for many, many years. So there are just some example letters here with information that's redacted for the people who got these letters. And so you can see, there's like an inaccurate denial due to immigration status, right? So you can see that this person that HHSC is showing that they're not eligible for benefits, and the application has shown that they are either not a citizen or a non-citizen who's qualified to receive benefits. And then there's a little explanation here about like why this letter is helpful for training or representative of a problem, right, that happens sometimes with HHSC. So again, just like a helpful training tool, because these letters are so complicated. The more that assisters see them and get used to them, the easier it is to help explain them to clients when they get one of them in the mail. So there's just like a little explainer here about who the client was who applied here, right? It was an F2 visa holder. HHSC often denies F2 visa holders Medicaid coverage. After October of next year, that will be okay, right? But until October of next year, that is not okay. And then also, importantly, for children, right? For children of F2 visa holders, they will still be eligible for Medicaid after October. So the changes that are happening with immigrant eligibility for Medicaid and CHIP do not affect children who are under 19 years old, just adults, and which in Texas is really just like adults who could become pregnant. Well, actually, they would have to have a green card status and 40 work quarters in Texas anyway. So anyway, I'm getting overcomplicated. These documents are super helpful for training. And if you ever want to do a deeper dive into this, what an accurate denial due to income looks like. There's a fraud letter here. And honestly, like I would love to get more of these for training purposes, also for talking with the Health and Human Services Commission. So if you go to that folder, or sorry, the survey that I mentioned earlier, I think it is here, you'll see at the bottom of it that there is an option to upload documents. Please redact documents before you send them to me, which just means like, scratch off somebody's name before you take a picture of a document, or afterwards, you can put a little black box over somebody's name, kind of like I did in those other documents. But also, if you send something to me through here, this is a Google form, so it's not like triple encrypted or anything. But I can also redact things after you email them to me or send them to me through this form. So if you do have any screenshots or anything that illustrate, confusing letters, problem cases, you can submit them here too. All right, I've done a lot of talking. I want to stop. Let's go through a scenario real quick. We've got a bunch of different topics that we'll cover here. These are our 6 scenarios that we've got for today. But also, like, again, if anybody has any cases that you're working on and you want to just like float them by this group, like we can talk about that together, or things that have happened commonly to you in the past during open enrollment periods, we can get to those things too. We don't have to follow the scenarios that are in this doc, or that are in this presentation is what I'm saying. They're just here to be like, helpful guides to using that folder so that we can see like where stuff is. And what kinds of tools that we can use during the open enrollment period to make sure that people are getting connected and getting covered. Okay, so let's see. Monica, say hi. Let everyone know who you are. I'm sorry that I just talked for 20 minutes about a folder with other folders in it, but let's get started with some actual like everyday stuff. So yeah, let people know what you're doing at MHP Salud, and then let's read through this. Monica, if you're talking, I can't hear you.
Oh, I'm sorry. Yes, I had
No,
not.
that's
Thank you so much, Lynn. Thank you. Actually, from experience, I really do appreciate, and I think everybody would agree that we appreciate all this wealth of information that we can use with our assisters and in the field. So thank you so much for sharing that. Again, my name is Monica Garcia. I am with MHP Salud. We are a national nonprofit that is dedicated to empowering individuals to pursue their journeys towards health and well-being. We have been leading this work with our community health workers for over 40 years. Our programs basically provide health education. They increase access to health resources, and they, of course, with the help of our community health workers, bring our community members closer together because they are very much trusted members of our community. We also have extensive experience in offering health organizations training and technical assistance on community health worker programming that is specifically tailored to the organizations that need support and their needs. So I'll go ahead and get started with the first scenario. Give me a second. Okay. So we'll start with this one. It says you're a financial programs counselor at a local health center in a county with 500,000 residents. The county operates a healthcare program for uninsured people with incomes under 200% of the federal poverty level that covers primary care visits at FQHCs and medications at any Lowe's grocery store in the county. You have an appointment today, which is October 1st, with an uninsured current patient at the health center who just got a diabetes diagnosis. The patient lives in the same county and has a spouse and 2 children. The 2 children, which are 9 and 12, are on Medicaid. The parents are 34 and 38, are green card holders, and the children are citizens. One parent earns income and recently got a raise, So she now earns $65,000 to $75,000 a year, and her employer does not offer health insurance. The parent with the recent diabetes diagnosis is concerned about bills that she has from the appointments and tests she got at the local health center that led to her diagnosis. She wants to know if there is a program that will cover her new healthcare needs and also help with the past bills. How would you advise this patient?
Thanks, Monica.
Welcome.
Yeah, so I would love if maybe a couple of people could put into the chat here, like what do we know about this person? What do we need to know about them, right? Like, is there anything that would be helpful for an application assister to say like, oh, let's let this person, let's help them fill out a marketplace application right now, right? Or what are our next steps here? And Simona just put in the chat, please raise your hand or put responses and questions here in the chat. Yeah, so let me just give it a second and see if anybody replies. And we can also just like kind of talk our way through this, Monica and Connie. So like if it's October 1st, right, we're before the open enrollment period. Do y'all think that this person would qualify for any kind of special enrollment period? What would we need to know about this person to know if they could enroll in marketplace health insurance to help with their diabetes costs right now? And Monica and Connie, let's just have a conversation about this one to kind of like model for the rest of the scenarios.
Okay. So on one, what we would want to look at is the income level.
Mm-hmm.
First and foremost. I know that you said, is there any special enrollment in here? It doesn't look like they had insurance to begin with. It doesn't look like they had Medicaid to begin with. Anything that would drop them, they were not already on the marketplace to get them any kind of moving or adding dependent or any tax change special enrollment situation. They may have been, to be honest, in a special enrollment situation if they had their application on the marketplace. I say this, and I'm sorry, my name is Connie Chalowinski. I'm with South Plains Community Action Association. I know you guys had our bios in there on presenters. I am a healthcare navigator. We do not work with community, like we don't do Medicaid unless it's through the marketplace. We do not do food stamps. We are strictly a healthcare navigator grantee out of South Plains community. So it's Wednesday.
Wednesday morning.
As a navigator, a program lead navigator, I stress to all of my navigators, get an application in. I don't care if they want to enroll. I don't care if they want to look at a plan right now. If they say, I don't have money, if they're below the 100% poverty level, and we know they do not get Medicaid and we will not get affordable coverage, get that app in, because it shows in here she recently got a raise. That's now pushing her in a different tax level, which can unlock her for a premium tax credit that she wouldn't have gotten previously, that allows her to enroll in marketplace coverage affordably now, instead of waiting for open enrollment. So one thing I will put out there is always get an app on file. Always take that time to put an application on file. So I don't know if you want to pull up the income chart, Lynn, because
Yeah,
it
I'll do that.
shows, okay. So income, does look to be over the 200% limit with the number of household members, as well as the income she is making, which makes those resources in the county not available to her. So if everyone pulls up their income level charts, they had a family of 4, and she is making 65 to 75,000, which is above that 200%, which means she cannot use the indigent or the Lowe's prescription program. Monica, did you have anything to add before I added anything else, or does anybody in this group have anything that they would like to raise their hand and add and hit on through any of this before I go further on anything else?
Not on my end, Connie. I think that's great. I mean, that's the information that we would share. Additionally, what we do in the field is we do screen for additional needs. And so that is something that is not necessarily, seen here. But what we do see is whatever there are maybe some other needs that the family might be needing. And so we do screen for that and make those resource referrals to the community.
Yeah, thanks,
Absolutely.
Monica.
Yes, and I was gonna add that as well, because each community has different resources and different counties that they service. So I do believe that that's where it is very important to do your community outreach and partner with your other community members to know exactly what services do you offer. Because there's numerous, there could be clinics that will see you at a reduced charge. There could be urgent care clinics that offer you memberships for the year until you can get them on the marketplace during open enrollment. There could be Good RX. There could be prescription assistance programs from the prescription drug company, as well as national prescription programs for a diabetes diagnosis. So I think it's very important to know who your community partners are through your outreach and through, speaking with people on panels like these and going to meetings and knowing who else is servicing in your community, in your area, to pick up the phone and say, hey, I need help. I've got somebody that really needs help in this area. So I think that's very important.
Thanks, Connie. Katie, I see your hand up. Is there something in the chat or the Q&A?
Yes, I'm just going to read out a few of the comments from the lobby chat.
Cool.
For the hospital bill, patient needs to contact hospital to see if they qualify for emergency Medicaid and or a discount in payment plans.
Mm-hmm.
Another person said, maybe the patient can contact the hospital and ask if they have a charity care program for past bills. I'm just going to keep reading so
Yeah.
we can translate too. Carol says, what if the household member who makes money is a caregiver to adult family members who would otherwise qualify by income? The family members cannot live alone due to disability. From the lobby, they don't qualify for SEP at this time, and children would be over income for CHIP or Medicaid. I would suggest a sliding scale clinic for now and have them come back in November, November 1st to sign up for the MP. Natasha said, we would put them on SFS and help with medication assistance. And then Amber said, the great thing is that PT is already getting care at an FQHC. The income has just changed, so parents need to report a change in income to HHSC because the children receive Medicaid benefits. Children's coverage may change to CHIP or even be over depending on the actual income. Parents can apply for Marketplace once open enrollment starts. Continue care at FQHC. Past medical bills can be paid, and payment plans or maybe charity services could cover partial bills. And that's everything.
It's like the lobby and the chat were in my head when I was like writing out the kind of like solutions to this scenario, because all of those things are there. That's fantastic. Yeah, we're all very much on the same page. The family probably doesn't qualify for a special enrollment period right now, right? So they couldn't get into the marketplace. So making them an appointment for open enrollment is really important. Like Connie said, though, get the application in, get it in right now. Get that family set up with a healthcare.gov account if they don't already have one, because that will smooth things out during the open enrollment period too, because there are so many fewer assisters across the state. We just need to streamline those appointments as much as possible. So get the application in October, like spend an hour and a half on it right now so that you can spend half an hour on it in November. And then you can get to the next person. I love that advice. Up on the screen here are some of the resources also that different folks mentioned in the lobby and that Connie and Monica mentioned here too. There is a page from the American Diabetes Association here with some different programs for insulin affordability. There's also prescription affordability guides here from Cost Plus and GoodRx, a couple of different programs that people use if they are uninsured, or honestly, some people use GoodRx and Cost Plus even if they are insured, because the medications will cost less sometimes there. So, we want people to use their health insurance programs, but really we want people to have affordable healthcare, whatever that looks like for them. So, yeah, this is so awesome. I love this. Let's go on to the next one. Thank you so much, y'all, for all of your comments in the chat. That's so helpful. And let's see. So scenario 2, Connie.
Okay. So you are a Texas Community Partner Program application assister and a family that recently got refugee status in the U.S., which will be 2 adults, 1 child under 14, comes in today. So that would be 10/1/2025 to ask about getting onto Medicaid. They heard that it is a good program that will cover the costs of blood pressure medications that the 2 adults in the family take. They'd like you to help them fill out an application for Medicaid. What do you ask them to learn more about their circumstances? And then what do you tell them based on different answers?
Thanks, Connie. Yeah. So this one's a bit complicated. I mean, they're all, every case, every scenario is complicated, right? Because every family is different. But we have had some recent changes in the availability of refugee medical assistance for people who have refugee status. So has anyone followed that closely, the new timeline, like the new time frame that people who are new refugees can be on refugee medical assistance? If so, put it in the chat, put it in the lobby chat, unmute yourself if you can. I will toggle over to this folder here. So if you're in the main Assister Resources folder and you go down to, what is it, General Info and Healthcare Education, Immigration Info and Resources here. Which one is it? ACA immigration categories, health programs for refugees and asylees. So we're talking about a family that just got refugee status, right? So if you click on this one here, if you scroll down, there's a lot of info on this page. You can see what types of organizations can help people enroll in refugee medical assistance. If people do have urgent health needs right now and they're not enrolled, there's a bunch of different regional organizations listed out here so that folks can get connected to health insurance, or sorry, health treatment options, even if they're uninsured right now, right? And then this section here is about refugee medical assistance. So the federal government changed refugee medical assistance from 12 months of eligibility to 4 months of eligibility. So the questions that we would want to ask this client or this family is, when did you get refugee status, right? Was it in the last couple of months? Was it earlier in the year? Was it last year in 2024, right? Because if people got refugee status before May of this year, then they actually still qualify for 1 year of refugee medical assistance, which would last them until a year after their status change, right? So if somebody got refugee medical assistance in, January or February of 2025, then they would be eligible for refugee medical assistance until January or February of 2026. So they would still have access to that coverage, which is not fully Medicaid, but it's kind of like Medicaid. So they would want to call their local office of refugee resettlement and get connected to refugee medical assistance. But what about but then after, like, so say their status, say they got refugee status after May 5th, right? Yeah, May 5th of this year. Then they would have 4 months of refugee medical assistance instead of a year. So if somebody, got refugee status in June, July, August, September, October, they could still have that kind of coverage, which means that as soon as they lost it, right, at the end of their refugee medical assistance, they could have a special enrollment period to get onto the marketplace as long as they enrolled in RMA, or I'll start calling it RMA, just for the sake of time. But yeah, but what about Medicaid? They came in asking about Medicaid. What would we tell them? And Connie, I realize that you don't do Medicaid applications, so Monica, I'm looking at you on this one, maybe. You're muted.
Sorry. Yes, there we go.
That's okay.
So what we would look at right now, we would look at, see, because the laws are changing. So maybe the child may no longer be eligible for Medicaid after September 2026.
But what about like right now? Because they're coming into your office today. It's like it's October 2025, so kids are still eligible for Medicaid, right? As long as their incomes are eligible. But what would you tell the adults? Like, so a Medicaid application might be appropriate for this child, but would it be appropriate for the parents?
Let me see. I'm sorry.
No, that's okay. Connie, I saw you just unmuted too.
Yes. So from my aspect on this, and I work with a lot of refugees. I'm in Abilene, Texas. And we did have a sub-grantee out of Amarillo. So we work very closely with International Rescue, and their caseworkers. So, and most on the positive side of what I see from the refugees that we assist is they are all green card holders. So even though the refugee resettlement and the letters and things, effective next year, they are not eligible for marketplace through, their citizenship is no longer eligible. We're losing a lot of individuals that will no longer be eligible based on refugee status, visas, things like that. Most of the refugees, if not all, hold green cards. So again, as a navigator entity, I would push them through the marketplace. Because at that point in time, that healthcare.gov will do the determination on if the children are eligible for Medicaid based on their citizenship and income. In this case, they would be eligible based on citizenship, so it would be the income driver. And I would let the marketplace determine that. And if it does push them over to Medicaid and CHIP and make that predetermination through healthcare.gov, and we need a quicker push on things, I would then contact a community partner in my area to see if they can follow through with your Texas benefits and keeping in contact with their tiers program or following up and checking to make sure their Medicaid or their CHIP application follows through, because we know how that can drop in the cracks when it transfers from Marketplace over to Health and Human Services.
Yeah, totally. Yeah, I love that you called out following up with folks, especially after the Your Texas Benefits applications. So helpful because, you know, there's like the paper notices are confusing all the time. Whether or not they get to people's homes is a question mark. But so, yeah, and I just want to just make sure that first question that we asked together, which is like, how long have you had refugee status, is really important also as far as whether somebody can actually fill out a Marketplace application and enroll. Because the refugee medical assistant status is kind of like having an offer of employer coverage. Whereas if you have an affordable offer of employer coverage, or if you have an offer of refugee medical assistance, or you know, coverage from a spouse or something, then that coverage offer will prevent you from having tax credits for the Marketplace. So you have to wait until the end of somebody's refugee medical assistance time period. And they do have to enroll also for it to be a loss of coverage, right? They can't just be eligible for refugee medical assistance and not enroll in it and get an SEP at the end of their eligibility for RMA. So you still have to connect them with their Office of Refugee Resettlement for sure, which is another kind of like just shout out here, like with the federally qualified health centers, like Paula mentioned yesterday with the charitable clinics, just like knowing somebody at your Office of Refugee Resettlement is really important so that when you do get somebody who has these questions, or you need to check on somebody's, you know, entry date, you can just call them, right? Instead of like sending somebody to that office, which can be very difficult with language barriers and transportation barriers and all the rest. Thank you all so much. Is there anything, let me check the chat and see if anybody had anything they wanted to add. Gracie says, oh, cool. Thanks, Gracie. Gotcha. From the lobby chat, RX Assist. Oh, I don't know RX Assist. I will, dang, that's fantastic. Thank you, somebody, for that super helpful tip about diabetes medication assistance.
I
All
wrote
right,
it
let's go on
down.
to You wrote it down.
I wrote that down. So
See, this is what I'm talking about. This is why we just need to like run through scenarios
Yes.
together.
I've never heard of rxassist.org. So I appreciate that. I did write that down in my notes. Yes.
Awesome. Well, we only have a few minutes left, but Monica, would you read through our third scenario, and we'll just kind of jam on it until we get to the end?
Sure. So a client comes into your office during open enrollment, and they say that they know which health insurance company they want to pick from the Marketplace for 2026. The client spoke with their doctor's office billing staff, and they said that the office takes Ambiter insurance plans, and that the client can set up their doctor as a primary care physician at the time of enrollment on healthcare.gov. The client also says that they see this doctor, who is an endocrinologist, about 6 times a year, and they want to choose a bronze level plan because the doctor's office said that the bronze plans will be the least expensive. How does your conversation with the client go about choosing the PCP from the healthcare.gov application? How does your conversation with the client about which metal level plan they might want to choose? What other information would you want to know about this client in order to share the most helpful guidance with them?
Thanks, Monica. Let's give it a second, see if anybody has any ideas in the chat. Juanita says refugees, court dates. Yes, thank you for that, Juanita. That was about our last scenario. So for our scenario here, we know that this person, they've got an endocrinologist who is a specialist, right? Not a primary care doctor. So there's a couple of complicated things here happening when the doctor is like, set me up as your primary care doctor on healthcare.gov. What do y'all think is actually happening with this scenario where somebody's like, you can pick a primary care doctor from healthcare.gov? Is that possible? Monica or Connie, have y'all ever set somebody's primary care provider from healthcare.gov?
We don't set the primary care health provider. We can look at the plans and then, determine which one they would be qualifying for.
Yeah, and Jordan just put in the chat also, I don't think so. It's always been after enrolling. And that's totally true. So what I think would be happening, yeah, and then from the lobby chat, I assumed it had to be through the plan specifically, and it does. Everybody is totally right on that. What I think is probably happening is like somebody who is talking, the really well-meaning person at this person's doctor's office is thinking about this function on healthcare.gov where you add filters to help pick a plan. And then you can go over here and you can add medical providers. And so this is probably what I think would be happening with this person, right? So that they're endocrinologists. Yeah, and Hannah says they'll first need to find a primary care provider because the primary care provider cannot be a specialist. And that's another tricky thing with this scenario. The specialist doctor is like, set me up as your PCP, right? But that's not possible. And so there's two things that an assister would need to talk to about with this client, which is one, you do need to set up a PCP, right? Just in general, unless you get on an exclusive provider organization, right? So depending on the type of Ambetter plan this person gets onto, they would either need to set a primary care provider or not. But either way, they will never be able to select an endocrinologist as their primary care provider, which is just to say that like, the ways that these plans are broken down, right? If you get to, you can see here, and this is just the first plan that's available to people in Hays County right now. You have different co-pays, right, for primary care and specialist care. So as much as I want my endocrinologist, I want to pay them $50 for a primary care visit, I can't do it, right? I'm going to pay a specialist copay regardless. A health insurance company is never going to let you pay that lower cost for a specialist visit. So there's a lot of education that needs to happen with this scenario here. And I realize we can't get to the bottom of all of it, but that one actually did come from somebody who wrote into our registration form for the Texas State of Enrollment Conference, like, hey, this is a case that I've had before. How do I respond to these folks? So really happy that we got to talk about it a little bit here today. And Katie, I see your hand up.
Yes, my hand, unfortunately, is the timekeeping hand.
Heard. We made it through
No.
3 scenarios, y'all. 3 is pretty good.
Can I say something? Can I say something real quick? Just because I couldn't get myself off mute. So I would advise go over the math, show them the cost of the plans, compare them and say, you're going to spend this much every time you go to the endocrinologist. If you choose this plan, you're going to spend this much if you choose this plan. I'm trying to go slow for our interpreters. Put it on paper and go over the costs of each different thing. Second, build an insurance profile for them to where you can choose the primary care for them and show them how to manage their own care through their issuer portal. That's all I had to say.
Thank you, Connie. We have 3 minutes left in today's session, and we want to start that poll up so folks can respond, but we also need to give away our 5th gift card of the Texas State of Enrollment Conference. I will be reading these out as I have in the other sessions so our interpreters can interpret. Question 1. I learned about digital resources and how to customize for my community needs. Strongly disagree, disagree, neutral, agree, strongly agree. Number 2. I learned about tools available to help families self-enroll and/or follow up with their health coverage plans. I strongly disagree, disagree, neutral, agree, strongly agree. Number 3, I learned about resources for enrollment assisters to help families fulfill new documentation requirements for benefit programs. I strongly disagree, disagree, neutral, agree, strongly agree. And those are our 3 poll questions. And with that, Simona is going to spin the wheel to see who our lucky 5th winner is for the TSOE. And I'll also say our next session is all about connection and learning. And so we might also have more time. Oh, hello, cat. My cat is here. To go through some of those additional scenarios and or answer any questions that folks may have. And our winner is Abigail Mares, is our session 5 winner. And Simona has put the name in the chat. Congratulations, Abigail. If you can raise your hand or respond in the chat box, we would so appreciate it. There she is. Congratulations. And with that, we are ending session 5. We will see you back at 10:30 a.m. Central Time for session 6, which is our last panel of the day, our last session of the day. This is going to be very different. It is not a webinar, it is a Zoom meeting. So we hope that everyone is able to join us in this Zoom space because being in the lobby, you might not be able to participate as much. And Lynn, any final thank yous, remarks before we hop off?
Mostly to you, Katie, for being fantastic. Also to Monica and Connie for your guidance and all of your expertise. And to everybody on this call for your feedback. Yeah, this is, oh, Monica, you are perfect. We can all space out about Medicaid whenever we need to. Thanks to Vic and Azucena and Hoy and Q for interpreting. And I'll look forward to seeing everybody in a minute or so. Or in 15 minutes. Take a break, grab some coffee. Good session, y'all. Keep me posted. We'll talk soon.